In the healthcare system today, providers are seeing an increasingly diverse population of patients. This diversity is seen in populations with different cultural traditions, languages, and ethnicity. Persons with deafness have a culture and language unique to them. In the medical model, deafness may be classified as a disability. However, in everyday life and in healthcare delivery, it can also be seen as a distinct language, American Sign Language, and as a community. This perspective will assist the nurse to be more respectful, effective, and accurate in her or his interactions and communications with the deaf community and individual. There are approximately 28 million deaf people in the United States, many of whom will require interpretive assistance in their encounters with healthcare providers and the healthcare system. The issue of accurate interpretation is significant and does impact the quality and safety of patient care. Interpretation in this healthcare setting involves three individuals: the patient, the nurse, and the interpreter. The patient and the nurse are the two primary participants, and the interpreter is responsible for taking the meaning from the message and then conveying that meaning. The interpreter is neutral or impartial in this situation. The interpreter is either a member of the staff or is contracted by the facility as a member of the healthcare team. The interpreter is covered and bound by the regulations of HIPAA, which allows access to personal health records. This case study illustrates the basic patient need to receive and give meaningful communication within the healthcare context. It presents an ideal situation in which there is an interpreter available to the nurse practitioner and the deaf patient before and during the patient visit. The interpreter meets separately with each before the exam begins. They are able to meet and discuss any issues or concerns about the communication during the delivery of care in this well woman visit.
Hi Ann, I'm glad you're able to provide this language service today. I will be doing a well woman exam.
Okay.
I'll try not to use much medical jargon, but there are a few terms I may need to use in order to appropriately explain the exam to the patient.
Right, okay.
She has indicated that this is her first exam in nearly 10 years, and it is only her second exam that she has had.
Okay, you said something about medical jargon. Can you tell me which word specifically you might be using? That way I can better prepare myself to interpret it when we get in there.
Sure. A few words I may use: bimanual exam, pap smear, vaginal speculum, rectal exam.
Okay.
Since it's been so long since her last exam, I'll probably spend a little bit of time explaining the pap smear and bimanual exam thoroughly.
Okay, bimanual exam, what exactly is that?
A bimanual exam. A bimanual exam is where I will take two fingers and insert them into her vagina. My other hand will be placed on her abdominal wall.
Okay.
I'll try to bring my hands together, and this allows me to better feel for the shape, size, and any abnormalities of her organs.
Okay, I think this is going to go pretty smoothly. Have you ever worked with an interpreter before?
No, I have not.
Okay, let me just give you some tips that might help this go a little bit more smoothly. First, you can speak in first person. You don't have to say tell her this or tell her that. I'll go ahead and take care of that for you. Also, I'll have to have a direct line of sight with Jane. For obvious reasons, I'm going to be signing to her, so it may require me to move around the room a little bit. And then thirdly, when I'm interpreting to her, there's going to be a slight delay. So for example, when you're going to warn her that you're going to touch her, just give me some time to sign that to her and then go ahead and do it. That way she's better prepared.
Okay. I think this will work well. You may need to remind me about the delays. When we enter the room, before I explain the exam to her, she's already completed the paperwork, so I would like to give her the opportunity to ask any questions that she may have regarding the health history and the consent forms.
Great. I'll go ahead and introduce myself to Jane now.
All right, thanks.
Mm-hmm.